Okay, so let's take a look at the thyroid gland. A typical thyroid gland is H-shaped, as you can see, and it has two lobes, so it has two lateral lobes, and each of these lobes have a superior pole and have an inferior pole. Now, due to the fact you can see that both of these lobes are not really similar and both of the poles of the lobes are not really similar. The fact that they are different, you can see that the superior pole is much more thinner as compared to the inferior pole. It gives a pear-like appearance to both of the lateral lobes of the thyroid gland. Then, if you look at this, if you weigh this gland, you can see that it's about 25 grams and about 4 centimeters in length. Then, let us see where it is located. Generally, we can say that it is located in the neck region, but but we can say that it is located at about between the first cervical vertebra and the first thoracic vertebra. Then, anteriorly, if you can observe, you can see that it encompasses and it covers most of the tracheal cartilage and also is in close relation with the trachea and the tracheal cartilage, of course. And then you can see that the region here in between, this region here, is known as the isthmus of the thyroid. And the isthmus of the thyroid is if you look at it, you can see that it is at the level of the fourth and the second tracheal cartilage. Now, there's also a close relation superiorly with the thyroid cartilage and the cricoid cartilage of the larynx. Then we can observe the posterior aspect. Posteriorly, we can see that it's in close contact with the four parathyroid glands that are found on the posterior aspect of the thyroid. Let us take a look on the anterior relations of the anterior relations of the thyroid gland. So the anterior relation of the thyroid gland include the strap muscles, and these strap muscles are quite important for the depression of the hyoid bone, which facilitates swallowing and breathing. These muscles include the sternohyoid, omohyoid, sternothyroid, and the sternpyrohyoid. Now let us look at these muscles on the atlas. Cumulatively, these muscles are known as the infrahyoid muscle. Okay, again, we can see all of the muscles right here. The first muscle we can notice is the sternothyroid. This is the sternothyroid muscle. Sternohyoid muscle, I'm sorry. This is sternohyoid. This is the omohyoid muscle. So omohyoid, this part of it attaches on the scapula, and the other end goes and attaches itself infertly to the hyoid bone. Then posteriorly, we can see that there is the thyrohyoid, and then lastly, we have the sternothyroid right here.